No, what we're seeing and experiencing in education in the time of COVID-19 is like nothing we've ever seen. Two earlier epidemics were localized in a small number of countries and didn't reach a pandemic level. SARS, for example, in 2003 and Ebola in 2014. Education was impacted with different policies in the affected countries, but there was no global spread and national educational impact as we're seeing with COVID-19 in 2020. For example, in 2003, somewhat over 8,000 people in 26 countries contracted the SARS virus, leading to about 775 deaths. And although the slow reporting of initial SARS cases helped the illness spread, globally enforced medical practices eventually helped end the outbreak and actually minimize the impact on education. In the case of 2014, over 11,000 people died, primarily limited to 3 countries in West Africa, and approximately 33 weeks of education were lost due to school closures in those countries. But the global impact of COVID-19 is affecting almost all countries on the planet, including the educational services, and will do so for a much larger period of time than in past instances. We're clearly in uncharted waters. Yes, recently some have pointed to South Korea as a successful example, both of limiting the health impact through prompt testing and isolation, as well as educational impact through the school closings and the effective use of digital technologies. But the Korean example is not easily replicated elsewhere. South Korea is one of the most wired countries in the world. Internet is ubiquitous. Education in the country was able to move to online learning from the blended educational system that existed prior to the virus. Further, the country is geographically small, well-educated, literacy and numeracy are universal, and access to digital technologies is available to all homes in the country. The culture is homogeneous, structured, and collectivist in nature. And citizens, have had centuries of experience putting the group or country ahead of individual and moving quickly in a unified direction for the good of all. Yet, even in this favorable situation, early on in the virus outbreak, a full 223,000 students said they didn't have the technology they needed to start online learning. So the Ministry of Education initiated a lending service to those lacking technology and access, according to the BBC. But this is not the reality in most of the world's countries, particularly in terms of inequality in levels of access to technology and connectivity and inclusivity in efforts to engage in learning at a distance when schools are closed. The key issue for me is having experience in both online learning and facing traumatic issues that have disrupted teaching and learning is to care for the whole individual, the whole student, including health, both physical and mental, as well as academics. Students need support to deal with the trauma of being away from friends and extended family, of missing physical activities and movement, and of possible family strife and potential domestic violence, and of the real possibility of hunger and other health issues in the absence of parental income and lack of access to medicine and quality food.